Hello, I'm Dr. Margaret Ames, and you're listening to Your Dental Health. You know, I really wanted to call the show Minimally Invasive Dentistry, but my producer thought that was a bit cumbersome. But that's truly what I'm about, is minimally invasive dentistry. There's too much amputational stuff going on. I mean, you have to remove tooth structure just to get room to put a crown on, to put something stiff and not flexible like the tooth. So anyway, the name of the show is Your Dental Health. You can reach me in my office at 631-261-4525. That's 631-261-4525. The mission of the show is to get the word out about biomimetic dentistry. Biomimetic means mimics life. It's minimally invasive. It's a major paradigm shift in dental care. You know, it's hard to get the word out because nobody's really saying, oh, this stuff is great. It's very complex. When you know it's important is when it's too late. When you say, oh my gosh, I had a root canal and that failed, and then I had to get the tooth out, and now I need to get a denture or an implant. I mean, those are horrifying, catastrophic failures of 20th century dentistry. So I really want to get the word out. I mean, this is all about spreading the word for consumers like you to demand that your dentist studies biomimetic dentistry. I also want for you to experience more comfortable and less invasive and beautiful dentistry. I've been practicing dentistry in Huntington for over 20 years. And I can't tell you how excited I am about it, even though it's been a while and I'm not getting into this routine of, okay, this is what I've been doing for the past so many years. It's really exciting. Last year in May, I went down to Belize and I did a dental mission. So I went down there to help some people who don't have good access to dental care. And the group that I went with they're great people, and the paradigm under which they practice is minimally invasive. So our goal was to remove decay on children. Normally, these dental missions are where the dentists go down and they start taking teeth out. But it's a shift. We want to stop the problem, the cycle of people losing teeth in poor countries. So the Belize government had accepted this group and actually gives us licenses to practice down there on a temporary basis. And we did a whole bunch of air abrasion and put in fillings without having to use any Novocaine. So this quality of dental care that these kids are getting is better than what most kids are getting here. They're not getting root canals. They're not getting stainless steel crowns. They're getting minimally invasive dentistry. But I'm going to take a little aside and tell you a story because it's so heartwarming to me. While I was in Belize, I met a young girl who is delightful, and she has changed my life. And I just had her come up to visit last weekend. What a joy. I have to tell you her background. Her name is Damari, and she lives in Belize. And when she was 14 years old, she actually, her aunt was on the roof of the house moving the antenna so that they could get better television reception. And her aunt moved the antenna and fell into the high-tension wire and was electrocuted. And she fell on top of Damari. So this woman who was probably 150 pounds fell on top of this little 14-year-old, and the woman died. And her niece, Damari, was under her for 45 minutes. The power company wouldn't come and turn off the power because they thought it might have been a hoax. So she was attached to her aunt electrically. You couldn't separate them. And when her little sister tried to, she got thrown across the yard. So out of that, you would think that Damari would be depressed. And, she comes from an area that doesn't have a lot. They live a very simple life. And she really did change my life. So she got airlifted through a foundation that knew how to get her from the Belize Hospital up to the Shriners Children's Hospital in Galveston, Texas. The woman who has the foundation said there's no money in the foundation right now, but I know that people to get you to. So she was airlifted, and it was $19,000 for the medical ambulance airplane, and the parents had to pay that back. So when I met Damari, she was the happiest, smilingest little girl with missing one leg and her right index finger. to see her smiling and to see her, the pain that she went through, moved me so much. She, as it turns out, when she came up, I brought her to places to speak because children need to learn her story, to learn that she was in excruciating pain for a month, having skin grafts, having her hair cut so that they could take the scalp skin and put it on the wounds. I just would love to hear her out there. I'm sorry I didn't get her filmed on YouTube to get the word out about her. But it was because of this burn and this terrible catastrophic accident where 45% of her body was burned. She met a hygienist who was in the same burn unit because her daughter had spilled a percolator pot of coffee on top of herself, her 3-year-old. So because of these two burns, Damari said to the hygienist, the little girl's mother, "Miss Kathy, we don't know what God's plan is for us. We don't know why we're here. We don't understand right now, but there's a purpose to this." And out of that, Damari wants to go to medical school. And actually, when I had her up, I took some impressions to try to do some Invisalign on her. And I'm asking the Align company to fund this. So I'm putting that out there to the universe, is Invisalign. You got to help this girl out because she's going to be a professional speaker. And she has a long life ahead of her where she has to be with a prosthetic limb and a wheelchair. So pardon me for digressing, but it was such a great experience that I had to share it. You couldn't imagine being near somebody that went through that much catastrophe. If you've just tuned in, I'm Dr. Margaret Ames. You're listening to Your Dental Health. And you can reach me in my office at 631-261-4525. So when I had Damari in my office on Monday morning, right before she left to go back to Texas, to go back to Belize, I brought her into the office and we took some impressions and photographs. And I had to, of course, check that she didn't have any cavities. No cavities. Even though there's lots of sugar cane in Belize, especially in her area, no cavities. She had some sealants put in by the group that I went down with, and she's had great success from that. So if you don't have, if you have cavities, you have silver fillings, they fail. Over time, they fail. Notice that they have to be replaced. 80% of dentistry is replacing old dentistry. So prevention is the word, and minimally invasive is the way to go. Damari is a perfect example of having these little sealants on her teeth. They're wonderful. They're glass ionomers. They're not the regular sealants that are commonly done, which have a 50% failure rate in 5 years. So in my practice, we do the kind of sealants that allow them enamel to mature. So if your kids are getting ready to go back to school, or not, they're not thinking about that yet, but call my office. We can get you in and we can do these minimally invasive sealants that actually allow the enamel to mature. We can clean out the grooves with air abrasion. Air abrasion can remove decay. It can just remove bacteria from the grooves so that those bacteria can't multiply. A groove in a tooth is so small that even a toothbrush bristle can't fit into it. So the parts of the tooth fuse, and then right between those two parts is a little cul-de-sac where bacteria can live. That's why the dentists say, well, we'll watch this. Well, what do you want to watch it for? Why would you want to allow the germs to live in there untouched until they make a big hole? So with air abrasion, I sandblast the groove, clean it out. The little particles are very tiny. They get inside the cul-de-sac that's between the two parts of the tooth, clean it out. Then I place a sealant in there, or if there is decay, the action of the air abrasion is much more gentle than the drill. A drill bit, it turns around. You can imagine you've seen a drill being used, a power drill. Well, a dental drill is very tiny, and it goes around in a circle. But it's not really a concentric circle. It wobbles a little bit. So there's some thinking that the drill could be the cause for some cracks in teeth. So the air abrasion removes the soft material, the debris, the stuff inside your tooth, and if you get down to finding that there's decay, you put in a filling, and if there's not, you put in a sealant. The kids in Texas where this process was begun, that we're seeing the poor kids, this doctor that started it, he brought in the poor kids on Tuesdays, cleared out his office, and he just said, okay, let's let these kids have at it. And some of them now are 25 years old. They have better teeth than a lot of American kids because he got it early. He educated the parents about how to clean the teeth. He used air abrasion. He used the glass ionomer cement sealants. having wonderful success. So he can't publish a research study because according to science, you can't study yourself. You have to get an outside source to study you. So he's searching for a university or a foundation to fund the study of this material. It will change the world. So we're going to have a break now. You're listening to Dr. Margaret Ames with Your Dental Health. You can reach me in my office at 631-261-4525. I have a great website, too, with the background of my past shows archived at drames.com. So stay tuned. We'll be back after the break.
Yes, I do. And when you give me that pretty little pout, it turns me into